My name is Scott Childers. I work as a hospitalist here at Methodist Hospital in Indianapolis.
I'm Abby Wegehaupt. I'm one of the hospitalists here at Methodist.
My name is Dr. Newsom. I've worked at Methodist Hospital here as a hospitalist for about 13 years now.
I trained in internal medicine, so I'm a generalist. I only see adults, and furthermore, I only see adults who are in the hospital. So if you get a procedure and you come into the hospital, or if you're sick and you come into the hospital, you'll usually be seen by a hospitalist.
We really serve as that point person of communication for helping organize everything that's going on with your care while you're here in the hospital.
It's challenging. It challenges me every day, just from a knowledge standpoint, variety of patients, very acute setting too, and so we have some pretty sick patients here. We get the pleasure of really taken care of. We have some great colleagues here that I get to work with.
My name is Rick Fiorito. I'm a nurse practitioner with hospitalist here at Methodist Hospital.
My name is Brianna Lusky. I'm a PA for hospitalists. When we come in the morning, we have a patient list that we're rounding on, and we work alongside a doctor, and we talk about which patients, who's seeing the new ones, and then we touch base too if there's any more complex patients. We'll touch base with the doctor sometime in the morning hours about those patients. And then after reviewing the charts, taking a look at anything that happened overnight, we'll head up to the floor and start rounding on all our patients. Sometimes I'm working with a lot of the orthopedic patients, sometimes I'm working with a lot of the urology patients. So it kind of just depends on the week. Sometimes I'll even be down in the ED admitting patients. So I work with a whole bunch of different doctors too.
I knew when I went into nursing school I wanted to be a nurse practitioner. I wasn't sure what specialty I'd want to be yet. But then when I worked bedside for so long on 5 South, getting to know the hospitalists and all the other specialties, I really liked hospitalist medicine as a good core place to kind of build my foundation.
We don't get to have the long-term relationship a lot of times as an outpatient doctor would be, but we are sometimes seeing them at their most critical, most vulnerable time.
I love the chance when we get to have continuity and we see somebody come into the hospital and we get to hopefully help them feel better, have a game plan and execute it and be able to get them back home and back to their lives.
We do get to know patients and families really well during the couple days they're here with us in the hospital, and so guiding them through their hospital stay, seeing them get better and go home is always the best part of the job.